Welcome back. With us right now from 7 Day Dental, we have Dr. Chuck Lee. Good to see you. It's been a while.
Nice to see you.
Nice to see you here again. And Dr. Christine Chung.
Good morning.
Good to see you again.
See you.
And today we are going to talk about gum disease and how it progresses, how you get it, how to prevent it, all kinds of things, right? Good to see you. So it's also periodontal disease, right? So tell me, when it comes to gum disease, I've often heard that it can start at a very young age and progress very slowly or very rapidly, just depending, even as a teenager. What is some of the underlying causes? Why does it happen, even if somebody who's brushing their teeth pretty well and doing a pretty good job?
You want to start?
Yeah, gum disease is a disease where you have three things that can cause. First of all, you have the host, which is your teeth, and then you have the bacteria, which is always there, and plaque or smear layer, food. So the more accumulation of food, and you don't remove it in a timely manner, it form calculus. So that calculus is what seems to destroy the bone.
Okay.
So you want to get rid of the food or the plaque as soon as possible, so you don't get accumulation of calculus.
Right.
So the longer the calculus is there, there's going to be more gum inflammation, causing destruction of the bone with the onslaught of just leaving your calculus there for so long, and eventually you lose bone all over the place, and that's when it's tougher to treat gum disease.
It can spread?
Sure,
Like
it spreads.
okay.
It can spread, and it can destroy some people. It seems to destroy faster than others. Some people have a higher immune system, and you see calculus, but yet you don't see bone loss.
Yeah.
And you get people that have not as much calculus, but yet they have more bone loss. So it's hard to figure.
Yeah.
The best way to treat it is to come to the dentist regularly, so that we can find out what kind of type of patient you are periodontally, and figure out how many months is best for you to come in to get the regular gum treatment.
And as far as signs of the symptoms that you might get, what are some of the things that people need to look out for? Maybe they haven't gone to the dentist for a while or something like that. Is there something persistent? Is there pain? What can happen that they can kind of decide, well,
Very good questions. So I just want to reinforce what he just said. Gum disease or periodontal disease, it affects a lot of patients in the population. Almost everybody has gum disease, but it comes in through stages. And the first sign and symptoms that the patients see at home is bleeding. Now, it could be from brushing or flossing sometimes. If you brush too hard or you floss too hard, it could bleed. But normally, a routine flossing or brushing, it shouldn't be bleeding.
Right.
And the first sign you see is when you do have bleeding, and then when it advances, you can start smelling your own breath, because tartar or bacteria buildup can cause bad breath. Okay. So that's another sign. And then when you eat, food get caught underneath your gum or between teeth, because gum disease creating a pocket or a periodontal pocket that every time you eat, food debris can get caught around it and cause attachment loss and eventually bone loss. And that's the end result of gum disease. And like he was mentioning, it affects everybody differently at a different rate.
Right.
It also is because due to, in a older generation, because of your immune system, sometimes you don't fight bacteria well.
Right, exactly.
So the infection can prolong. And so that's why if you have these early signs and symptoms, please call your dentist. Go to your dentist regularly so we can diagnose and come up with a treatment plan for you. We now do non-invasive treatment, which if you are getting to later stage in the gum disease, we can do a non-invasive with laser.
Oh, okay.
You want to talk a little bit about?
I've heard about that a little
the
bit.
laser?
Yeah, well, there are a lot of studies that show that laser seems to stimulate the gum tissue and it debris the socket, the pockets.
Right.
And it allows the gum to grow back and gain attachment. You're not going to gain bone, but you're going to gain more tissue attachment. But I want to bring up is I noticed that in an older age, I noticed there's less people are starting to take more medicine, and so one of the side effects is dry mouth.
Yeah.
And dry mouth, so dry mouth says you have less salivary secretion, and that can cause a lot of plaque to build up. Because I've had patients where I said, "Did you brush today?" And they said, "Wow, I did. I didn't even eat anything last night." And I said, "Well, how come there's food all over the place?"
Yeah.
Because when you have less salivary secretion, you're going to have to spend much more time brushing, and for some reason, the plaque is just harder to remove.
Yeah.
If you look at kids under 10 years old, they can eat and not brush their teeth, but yet their teeth are so clean because of this.
Yeah.
Your saliva is
Very
clean.
true.
Yeah, yeah. And you know, you bring up a very good point because I certainly noticed that, let's say you have a cold, and so you're taking antihistamine, you're
Yes.
doing that. So maybe even after you take it, you know, for 2 weeks or so, you can feel that your mouth is drier.
Yes.
Right.
And then, you know, once you're done with your cold and go back, then things are fine again. But that's a very good point. For somebody who's taking different medications regularly, that's going to persist, right?
Yeah. So it doesn't mean that if you brush and you floss, then you're okay. Because as you
Yeah.
age, you may have to brush and floss more. You know, so
Right.
I think the best thing is one, go to the dentist and find a dentist you're comfortable with or a hygienist that you're comfortable with that goes over your mouth, kind of like drop a map.
Yeah,
Let you know,
yeah.
hey, this area you need to spend more time. Here
That's
you're
a good
doing
point.
good, and
Yeah.
every time get that reinforcement, and maybe the dentist and the hygienist can recommend more useful things. For example, we recommend a pick, a toothbrush, proxy brush. For some patients, we may recommend a rotary
Okay.
toothbrush for some patients, and sometimes we recommend the water pick.
Yeah, those are still around, are they?
Yes.
I remember they were so popular years and years ago.
So everyone has a different
Yeah.
Regimen
problem.
at
Let me
home.
ask you a question kind of along those lines, different treatments that I'm talking about people can maintain at home. What about the mouth rinses and mouth washes? They have the fluoride rinses or something. A lot of, they have them for kids, but adults as well. And then just using a mouthwash once a day or whatever it might
That-
be.
yeah,
Does
yeah.
that really help? Are there
Yes,
certain
yes.
brands, obviously. Others are probably just, breath fresheners.
Yeah,
but-
that's really is a helpful regimen at home. ADA approved Listerine, I believe. So
Yeah.
it does have a lot of alcohol. It gives you a fresh breath. But sometimes it does stain a little bit, but you go to the dentist, we'll clean it, all the staining and polish for you. But sure, brushing, flossing, rinse once or twice a day, it's good. If your disease is more progressive, then we would prescribe something a little bit stronger than Listerine.
Yeah.
Yeah, but it's not a long-term use. It's
Right.
just for a short period of time. But then again, we need to be able to diagnose which stage are you at of the periodontal disease or gum disease.
Yeah, and that way you can tailor whatever is needed to that specific patient,
Yes,
right?
yes, yeah.
Yeah,
So I
definitely.
couldn't stress the importance of visiting your dentist regularly.
Yeah.
Although you might feel, oh, I don't have anything, my mouth feels fine, but you never know. When we take X-ray, when we do clinical exam, we
Yeah.
can find out a lot of stuff.
Exactly.
Yeah.
Yeah.
Gum disease is a silent disease. It doesn't show up, and it's hard to know.
Yeah.
Most people that come in, they never knew, because if they knew, they would have been in already. And now with they have found links between medical issues such as heart disease related to gum disease. So it's wise to you know, go see your dentist more often.
Yeah, exactly. Thank you for coming in. We appreciate it. And their information's on the screen there, 7daydental.com, 949-859-3988. If I could read it with my, there we go. Good to see you. And both of you again. It's nice to see you back here. It's been a while.
Yes,
Hope to
thank
see
you.
you both again. And you're located right nearby, right?
Yes.
Yeah.
The next, it used to be Vaughn's, but now they're going to have Aldi.
Yeah.
And,
And you're getting a remodel of it.
Yes.
Yes.
Finally.
Yes.
Yeah.
Yes.
Definitely.
It's gonna be nice.
Good to see you.
Thank you so much.
Good to see you.
Yeah.
Always a pleasure. And we'll be right back.